Hello and welcome to another episode of Real Health. I'm Michael Porter and thank you so much for tuning in. Now, in the last episode, you would remember that we introduced the Women's Health feature where Dr. Mark enlightened us about the intricate system of hormones. So today he's back along with Sister Elise to help us understand menopause. Welcome to both of you. Thank you for coming in.
Thank you, Mike.
Hello, Michael.
I'm going to jump in and say, sort of from a layman's point of view, some people think that as a woman, menopause is the beginning of the end. Is this true? Maybe give us a sense of what menopause actually is. Elise, let's go with you.
Okay, that's not that straightforward an answer. All right, because we have different phases of menopause. We speak about premenopause and perimenopause, menopause, and then postmenopause. And to get into those phases, you need to understand the cycle or the biorhythm of the woman or the female.
Right.
And premenopause is usually our reproductive years.
Okay.
And that time we also uses contraceptives to regulate when are we going to have a baby or not. And that comes with its own problems. Do you want to elaborate
Absolutely.
on that?
So, Michael, one of the things that we see more and more often is that with certain hormonal oral contraceptives, we put ourselves or we put our patients into almost chemically induced menopause.
Right.
They present with the chemical and biochemical picture of someone who is postmenopausal.
Okay.
And often, some of them start presenting with signs of menopause, hot flushes, mood swings, irritability, in their reproductive years still. So these can be your early 40s when they still have a regular menstruation, etc., etc. So a lot of medication, like we discussed last week, can create imbalances and pseudo effects which patients experience quite often.
Okay.
Yes.
Okay.
And also in this stage of life or phase of life, women present with cholesterol problems and thyroid problems. They start seeing, okay, I'm gaining weight and I don't know why, etc., etc. That is your premenopausal phase.
So if I can maybe, let's go just a touch back. So menopause itself, as I understand it, is the sort of the end of your cycle of fertility, and you then going into
Yes.
the next stage of your life. So we talk about the influence of lifestyle and medication on hormonal balances. When naturally would that change be occurring from an age perspective, from going in from the reproductive high time to that down time at the end of your reproductive
As early as your early 40s.
Okay.
Yeah.
Okay.
The theory say early
Right.
40s.
Okay.
So, Michael, in our early 40s, from 43 onwards, we also now start going into the next phase of our cycle, and that's the perimenopause.
Yes.
Now, for us, this is the most confusing of the phases for the simple reason, when we look at our hormones, biochemically, they are normal. Our patients are at this stage where they start presenting with not so much hot flushes, because that's a clear indication, but with mood swings, sleep problems, irritability, depression, anxiety, loss of motivation. They present to their GPs, their gynaes, as something's wrong. I'm not feeling right. Now, at least you went through this stage.
Yes, I do.
What were you experiencing?
I'd like to think I'm still in that stage. Okay, so exactly what Dr. Mark said. I had all those symptoms, but I never realized this is what's happening with me.
Yeah.
And when I went to my doctors, they would say, oh no, there's nothing that I can do for you at this stage. Or let me put you on contraceptives so that we can regulate your menstrual cycle, etc., etc. Yes, at that stage it helped, but I never came out of that perimenopausal phase where I understood what is happening with my body.
it's so worrisome that so many of our patients present after going from doctor to doctor, specialist to specialist, blood test after blood test, and they're told, but there's nothing wrong with you.
Yeah.
They eventually start feeling as if they're going mad. I'm not feeling great. Why are you not helping me? I want to defend my colleagues here. This, as I said earlier, this is a very difficult stage to treat, diagnose, and a lot of us don't have the time to really go and look at the balances in all the other systems.
Yeah.
And it's when you do that you start, okay, this
Put
is
two and
where
two
you
together
are.
suddenly,
Yes.
right?
And
So just on that, I think what's quite important to discuss is the fact that menopause is pretty much inevitable, as I understand
it is inevitable.
And are we seeing menopause is more extreme, or the side effects of menopause have become more extreme in the modern age? And secondly, or thirdly from that, is hormonal treatment around menopause, it's not about stopping it, it's about managing it. So how that attitude of like a doctor saying there's nothing we can do for you, you're going to have menopause, but it doesn't have to be horrible. So you guys are working on ways of managing it so people can go through it in a more, maybe say, pleasant way?
So, Michael, one of the things that we need to understand is menopause is a series of conditions. When you do not treat these conditions, it's not only about management. If you do not treat these conditions, it has a severe negative impact on health, morbidity, and mortality.
Right.
So we look, for instance, at cardiovascular system. If you do not optimize your hormone levels, especially estrogen, your risk for cardiovascular disease elevates. Now we look at some of the other major things: Alzheimer's disease, dementia, osteoporosis. If you do not use hormone replacement therapy, your risk and side effects because of these comorbidities that you develop directly as an effect of decreased hormones becomes a major contributor to death, decreased quality of life.
Okay. So then, in terms of a protocol, if we can call it that, of managing hormonal replacement therapy, how do you go about that in terms of what would someone expect if they're going through menopause and they're now engaging with you for a therapy?
We don't give out any information without consulting with these patients. So they come in for a full consultation, which is a one-on-one consultation, and there they just unpack everything that they feel and what they see, and etc., etc. From there, we take them a step further and say, okay, we understand this is what's happening with you. Please go for these blood tests. And then they come back, they had time to think about what's happened with them and process what we told them, and then we discuss the blood results in relation to how their systems are working, hormonal systems are working, and work out a treatment plan, which can consist of topical application of
Right.
hormones, injectables, what else?
IV nutrient therapy,
IV nutrient therapy,
bespoke
supplementation.
supplementation,
Yeah.
etc., etc.
Okay.
So it's really understanding what the patient is going through, but the only way that you can relate that is understanding their medical history. I use a simple analogy of a racing car team. The person's physical body is the car. I can plug it into a computer and I can get data. According to that, I can fix whatever is wrong.
Yes.
If I put that person in the driver's seat, they now might experience that I'm not braking well enough, or I don't have enough acceleration, or the seat's in the wrong position. They communicate that to us, the technical support team. And what we are able to do then is, through proper communication, we make small adjustments in our treatment protocol, and that gives you the ultimate driving experience
Right.
until it starts raining. And suddenly you know what, we have to make new adjustments. And that's what makes us a little bit different
Yeah.
to just a prescription. Here's your hormone replacement therapy.
Indeed. So it's really not a one-size-fits-all solution in any
Absolutely
way,
not.
shape, or form.
At all.
So I think we've given a lot of people some hope, probably, I imagine, that it doesn't have to be such a tough ride through menopause. Guys, thank you so much for
Thank
sharing
you.
some great
Thanks,
insights once
Michael.
again.